the protective factors. All right. So also you have to also understand what aggressive factors are and what protective factors are, because peptic ulcer occurs when these aggressive factors they overwhelm the protective factors, and also when the protective factors fails. So what are aggressive factors? Aggressive factors are those components in the stomach that helps us break down food. They are very aggressive. They help break down food. Example include the hydrochloric acid, the bile, the pepsin. Those are enzymes that break down proteins, carbohydrates, and other components in the stomach. So these are aggressive factors. Then the protective factors are those components that protect the walls of the stomach from these aggressive factors, because these aggressive factors, they have the ability to also injure the walls of the stomach. So the stomach has to be protected from them. So peptic ulcer disease is primarily caused by H. pylori bacteria or long-term use of NSAIDs, non-steroidal anti-inflammatory drug. That is what NSAID means. That's certain pain relievers. So we'll discuss this later. Now let's go to the signs and symptoms of peptic ulcer disease. The first sign and symptoms, you are going to be looking at epigastric pain. You get a pain just above the abdomen, and while you are feeling this pain, sometimes this pain might radiate to the back and even to the arm and other parts of the body around the stomach. Then you can feel this pain such that sometimes it can even wake you up at night. That's what we call nocturnal pain. Then you now have indigestion and bloating. Always your stomach is producing gas. Any little thing you eat, you are feeling like you want to fart, you want to belch, you are not always at rest or at ease. Then you can feel nauseous, your feeling of like wanting to vomit at times, or sometimes even vomiting. Then your pain may increase after eating, or it may reduce after meal. You understand? So the pain may increase or reduce after meal. Then other severe symptoms include vomiting blood. These are very severe symptoms when the perforation have gotten from the stomach to other blood vessels. That is, the content of the stomach can now go into the blood, and blood too moving into the stomach. Those are very severe symptoms. So vomiting blood, dark black or tarry stool. That's you when you defecate, you notice that the stool is dark. Though this can also happen when you're on blood tonics. But when you are not on blood tonic and you are seeing that your stool is dark, black, or tarry, and sometimes you feel those kind of pains and other symptoms we have discussed, you might want to test for ulcer. Then sudden, severe, and persistent stomach pains, unexpected weight loss or dizziness. These are some of the severe symptoms that you can see in peptic ulcer disease. Then now, frequently asked questions. We ask, can fasting cause ulcer? Then this would be discussed by the nutritionist. We throw more light on it. So, can fasting cause ulcer? No, fasting cannot cause ulcer, but I will only tell you that fasting, we know we are in a period of Lent. My Catholic brothers and sisters, a handful of them are fasting. So they may want to know if fasting can actually cause ulcer. But no, fasting doesn't cause ulcer, but when you have ulcer already, it can actually worsen the symptoms of ulcer. Now, another question is, do you mean anytime I have a pain in my stomach, it is ulcer? No, there can be other causes of pain in the stomach, which food poisoning can be one of them. There is gastritis. Gastritis is not ulcer, it's just an inflammation of the stomach. There is also irritating bowel syndrome. Yeah, even presence of worms sometimes can also cause certain kind of stomach pains. But it's not all stomach pains that are ulcer. Now, another question is, can children get ulcer? Yes, children can get ulcer. Children can actually get ulcer. And how do they get it? One, we all know that children don't take alcohol, they don't take pain reliefs for a very long time, they don't abuse pain relief. But I would like to let you understand that there is a bacteria, just as I've mentioned before, H. pylori, that can be transmitted even in the family. It can easily be transmitted. And when this bacteria is transmitted to your kids, this bacteria can actually contribute to causing ulcer in your children. So that H. pylori bacteria is one of the major cause of ulcer in children. So how is H. pylori contracted and how not to contract it? H. pylori can usually be found in contaminated water, and foods that are not properly cooked. Yes, and also very close contacts such as kissing, yeah, have shown to transmit this bacteria. So if there is a kind of very close contact, it can easily be transmitted. That is why we encourage use of personal belongings in the homes. Yeah, personal belongings, very important. Then how do I confirm if I have peptic ulcer or not? First, we will look at the confirmation, which is the diagnosis. In order for you to know if you have peptic ulcer or not, you have to diagnose, you have to run a diagnosis. And there are two main diagnostic tests. The first test is you have to identify if H. pylori is involved or not, which the first group of tests are the urea breath test or the stool antigen test. They are going to check for the presence of H. pylori in the stool or in the stomach. Then the second diagnosis method is endoscopy. This is where they pass the camera through the mouth, tiny camera, and it will visualize both in the stomach and in the small intestine to know where the injuries are. Then let's discuss NSAID-induced ulcer. What are NSAIDs? NSAIDs are non-steroidal anti-inflammatory drugs. And these non-steroidal anti-inflammatory drugs, they help us relieve pains, but they are meant to be taken for a short period of time. But whenever they are abused, maybe taken in very high doses or taken for a very long period of time, they can actually erode the walls of the stomach and the intestine. So, and also you have to take them after food, because when you take them on an empty stomach, they also increase the chances of eroding the walls of the stomach or the intestine. So they reduce the production of protective factors. Example of protective factors are thick mucous membrane covering the stomach. This thick mucus, together with bicarbonate, they are covering the stomach so that the acid doesn't injure the stomach. So they help reduce that. And when these protective factors are reduced, these aggressive factors can easily attack the stomach. So this gives the aggressive factors opportunities to erode the walls of the stomach. So same diagnostic method is used for both H. pylori-induced ulcer and NSAID-induced ulcer. And this is because in NSAID-induced ulcer, sometimes H. pylori may be present. So you have to detect if H. pylori is there or not, so you know which method of treatment you are going to use. Now, treatment of NSAID-induced peptic ulcer. The treatment of NSAID-induced peptic ulcer involves discontinuing the NSAID. Now, when you are taking an NSAID, you notice that it's already giving you signs and symptoms of ulcer. First, you have to do is, when you visit the pharmacy, the first thing you are going to do is to discontinue that medication that you think is causing this ulcer. And what are NSAIDs? Example include diclofenac, ibuprofen, piroxicam, indomethacin. These are NSAIDs. They are very good for pain relief, but they are not meant to be taken for a very long period of time or to be abused or taken in high doses, but they are necessary for pain relief. So they have to be discontinued when taken for a very long period of time. Then also, when NSAID-induced ulcer is detected, you need to also test for H. pylori to be sure that both are not involved in the ulcer. You need to test for H. pylori infection too. So when in NSAID-induced ulcer, when you have tested for H. pylori and you notice that it's just NSAID that is the problem, you have to use some of these medications. In example, include your PPIs, that's your omeprazole, rabeprazole, esomeprazole. Either of them that works very well and that you feel okay with is what you are going to use. Or your H2 receptor blocker like your cimetidine. Yes. Then there are also prostaglandin analogs and sucralfate. This can also be used. And sometimes they may be used together or sometimes they can be used alone. So another question that we get sometimes is, Farm, I am at risk of having an ulcer from long-term use of NSAIDs. This is due to an arthritic condition. How do I manage my pains and still prevent complications from ulcer? Now, we all know that in an arthritic condition, there is no way you won't do it, that you will live without pain relief. You have to use pain reliefs in arthritic conditions. So the first thing we are going to do is to always take the minimum dose, the minimum therapeutic dose of that NSAID, and you should use them only when needed. Let's assume you sit at home always. Sometimes the pain may not really come, except maybe when you walk around. Any day you know you'll be walking around, you use your NSAIDs at the minimum effective dose possible. Then sometimes we may decide to substitute or support your oral NSAIDs with pain relief sprays, creams, and patch. Yes. Sometimes there are a lot of patches and pain relief sprays, such as Deep Heat, which you can get at Kenix pharmacy, Deep Heat, Neurogesic creams. These are Neurogesic Extra. These are creams and sprays that you can actually get at Kenix pharmacy limited. Then you can replace your NSAID with other pain reliefs that are safe. Yeah, instead of diclofenac, we may decide to change to something that is also effective, maybe Atrotec. That one is quite ulcer friendly too. Then you also need to eat healthy and also eat very well before taking your non-steroidal anti-inflammatory drugs. Then treatment options for H. pylori induced peptic ulcer diseases. The treatment option is based on the causative agent. So if H. pylori is present, an eradication therapy should be used. The eradication therapy, this helps to heal the ulcer. That is the first thing the eradication therapy does. It helps to heal the ulcer while eliminating that bacteria called H. pylori. So in the eradication therapy, there are three major components, which are your PPI, which is your proton pump inhibitors. They may be omeprazole, esomeprazole, rabeprazole, or lansoprazole, any of them that works best for you. And also two antibiotics that are targeting the H. pylori bacteria. So these are the three major components in eradication therapy. Now, how do you treat with an eradication therapy? In an eradication therapy, that you need an ulcer kit, that is one. And this ulcer kit, they usually last for 7 days. And you can see some of them on the screen. They usually last for 7 days. So you need to get your ulcer kit for a 2 weeks period. So you are going to take this ulcer kit for 2 weeks. After you are done taking them for 2 weeks, you are going to then continue with a PPI, that's your omeprazole, your rabeprazole, or your esomeprazole for another period of 4 weeks. You are going to use PPI alone. After you are done with your 2 weeks regimen, you start taking your PPI alone. You can add an antacid to it, but your PPI, you need to take it for 4 weeks. Why are you doing this? You are doing this such that the 2 weeks period, you are trying to eliminate the H. pylori, while the other additional 4 weeks of PPI is actually a waiting period for you to be able to test if this H. pylori was eliminated or not. So as you can see, these are some of the NAFDAC approved ULCER kits that are present in Kenix Pharmacy Limited. So what should I do to ensure I eradicate H. pylori bacteria? Well, to ensure that you eradicate this H. pylori bacteria, you have to stick to your medications. That is very important. You don't skip your medication, and also you don't take things that are going to, increase this the ulcer injury again. So you stick to your medications. Those are the most important thing. Then what should I do if H. pylori isn't eradicated after 2 weeks of therapy and 4 weeks of PPI? Now, what you should do when you notice this this thing, H. pylori hasn't been eradicated, is that you go back to the pharmacy or your doctor, and the pharmacy is going to run an assessment to know which antibiotic you are resistant to. It is very possible to be resistant to a particular antibiotic in the ULCER kit. Yes, so you have to go back to the pharmacy and then you for, you go back to the pharmacy, then you run an assessment, and then they will check if there are antibiotics that you are resistant to or not. So let's go back to the treatment. First, just as I have said, 2 weeks of taking the kits. Then at the end of the 2 weeks, you do 4 weeks of your PPI, that is your proton pump inhibitors, which is omeprazole, esomeprazole, lansoprazole. Then that 4 weeks, you have to go back for the test. Then when you go for this retest, they are going to check using stool. And the reason why we recommend the use of stool is that sometimes when blood is being used, it might bring up a false positive result. Why is that so? When this bacteria is eradicated, some of the parts, the dead parts of this bacteria can still remain in the blood for a long period of time. And after testing, this result will still come out and show a positive result. But when you use stool, stool is always moving out. So it can give you a good idea of whether this bacteria was eliminated properly or not. All right. So the 4 weeks of waiting is just to tell you if this bacteria was actually eliminated or not. So if you notice that it wasn't eliminated, you come to the pharmacy or you visit your doctor and he can change the regimen for you. There are different substitutions. They may decide to substitute amoxicillin for metronidazole. They may decide to substitute metronidazole for tinidazole, or he may decide to substitute clarithromycin for levofloxacin. So these are ways they manipulate and make these treatment plans work. So what are the factors that can prevent ulcer healing in eradication therapy? One is when you are using proton pump inhibitors and H. pylori is present. Use of omeprazole alone, esomeprazole alone, rabeprazole alone, when there is H. pylori, your ulcer will not heal, because omeprazole is meant to help heal the ulcer, But in the presence of H. pylori, as the omeprazole tries to heal, the H. pylori keeps breaking down the walls of the stomach over and over again. So you have to eradicate the H. pylori. That is why it is called an eradication therapy. Then skipping medications also. When you keep skipping medications, you forget to take your ulcer medication, the ulcer keeps reoccurring and it becomes a problem. Also, smoking. What does smoking do? Smoking reduces the flow of blood to the stomach. And one of the protective factors is when enough blood supply is going to the stomach, the blood will carry materials necessary for creating more protective factors. But by the time that blood supply is reduced, it's going to cause a kind of shrinking. And you know, any part of the body where blood supply isn't enough, there is going to be reduction in rate of healing. Then alcohol, taking of alcohol. Alcohol can increase acid secretion in the stomach. Caffeine, caffeinated drinks too, can also increase acid secretion in the stomach. Then stress. Stress can also, worsen ulcer. Thank you for listening. I will now be handing over to our nutritionist, Ms. Adesua.
Good morning, rather good afternoon, everyone. Once again, you're welcome to the first Kenix Care conversation of the year. I'm Egbe Adesua, and I'm the nutritionist for today. All right. So today, right now, we'll be going over the food that help with ulcer, the harmful and helpful food in ulcer treatment. Now, why does nutrition matter when it comes to dealing with ulcer? Let's note, nutrition is not a replacement for your medications. That brings us to the fact that food do not directly cause ulcer. Food is not a causative effect of ulcer. That is not the reason why you have ulcer. We have a diagram here that shows the stomach, a picture of a stomach in discomfort. Now, food plays a large role in that. Food influences acid production, and certain food worsens the symptom for ulcer, same as the way certain food reduces the symptoms of ulcer. Proper nutrition supports adequate healing in ulcer. Now, when talking about nutrition in ulcer, what are your goals? Why do we need nutrition in ulcer? Nutrition reduces irritation. So there are certain foods that trigger irritation in ulcer, while there are other foods that reduces irritation in ulcer. Nutrition controls acid stimulation, supports tissue repair, and prevents reoccurrence. We have instances of people saying ulcer is incurable. Why do they think ulcer is incurable? They say, oh, I've been treating ulcer over and over and over again for years, but it keeps coming back. It will go and it will come back. Now, nutrition plays a large role in that, because after your medications, if you do not continue with a proper nutrition plan, there is a high chance that your ulcer will keep coming back, and then you keep thinking it's now an incurable disease, but it is not. Now, when we come down to the common myth that people have in ulcer, people have so many things. I've heard so many things about ulcer. Some people will tell you, oh, milk cures ulcer, but does it really cure ulcer? No, it doesn't. In the case of ulcer, milk helps, yes, sometimes, but it's not a cure of ulcer. Neither do pepper cause ulcer, or because you have ulcer, you should now be living on bland diet. When I mean bland diet, I mean no spicy food, no pepper, no Maggi. I've heard people say don't use pepper, don't use Maggi, don't use salt. It triggers ulcer. So what will you use? Should we keep eating just one meal? No. Spicy foods or bland diet forever do not cure ulcer. Neither does fasting heal ulcer. I don't know why people think fasting heals ulcer. Going a prolonged time without eating does not heal your ulcer. Now that brings us to what are the food habits that worsen ulcer symptoms, or what are those harmful practices that we have when it comes to diet and lifestyle? Now we're talking high fat and fried food. They delay gastric emptying. Now, when we're talking about high fat fried foods, we're talking about your processed foods. Some people, there are many people that everything they want to eat has to be fried. You see somebody eating fried potato, fried yam, fried egg with orange juice, and you have ulcer. Now, that is not causing your ulcer, or that is not going to cause ulcer to somebody who doesn't already have. But does that delay the healing of your ulcer? Of course it does. High fat diet and fried food diet delay gastric, so they stay in the stomach for long, thereby triggering constant acid production. And in ulcer, in management of ulcer, what we are trying to prevent is the consistent secretion of ulcer, as gastric acid, sorry. So now when you keep having high fat diet, fried food, you are doing otherwise. So you are doing what you're not supposed to do. You are causing excess secretion of ulcer of gastric acid in the stomach, thereby worsening the ulcer symptoms. Now, that brings us to caffeine-containing beverages. When we talk about caffeine-containing beverages, I'm not just talking about coffee. We're talking about your popular energy drinks. You say, oh, I work a very hard job. I must take energy drink to keep me active. It's not affecting my ulcer in any way. It is. Caffeine is affecting your ulcer, just like the last speaker said. When you take excess caffeine, it affects your ulcer the same way as highly acidic fruits. Now, fruits are beautiful. They are highly nutritious, they contain healthy micronutrients, but not all food should be eaten during ulcer. When we talk about acidic fruits, we have your citrus fruits. We're talking orange, we're talking pineapples, we're talking some kind of grapes. Now, should you stop eating them totally? That is not what I am saying. Nutrition does not collect from you. Nutrition does not tell you, don't eat this, eat this. But should you eat acidic food on an empty stomach? As an ulcer patient or someone who is managing their ulcer symptoms, eating citrus fruit when you've not eaten, like as your first food of the day, is causing more harm than good to you. Even if it doesn't show immediate symptoms at that point, but it's causing way more harm to you than it's supposed to. So there are other fruits you can eat that don't have to be acidic. Now let's come down to alcohol. What does alcohol do when you take it, when you have ulcer? Alcohol does not cause ulcer. I did not say that. Alcohol doesn't cause ulcer, but alcohol impairs mucosa defense. My colleague talked about the mucosa lining of the stomach. Now, what does alcohol do? Alcohol goes there and then it weakens it. So now, let's take egg as an example. When you boil an egg and then you're peeling the egg, there is this kind of transparent film that covers the egg. So now let's take that as an example. So our stomach, now our stomach is the egg, and that film is what is protecting the stomach lining. So alcohol goes there and then it eats away that film. It makes it so weak. So when the acid comes in, it's now weak, it's defenseless. It goes in there and attacks it. Now imagine you have an active ulcer. You know what ulcers are, like my colleagues say, there are injuries in the belly, in the stomach lining. Now imagine there is an injury there and then you pour alcohol on it. Even when you have an injury on the surface of your body and then you add spirits, we all know how that ends. Now imagine it internally. Taking alcohol worsens the symptoms. Highly spiced meal in sensitive individuals. Why did I say in sensitive individuals? We all have different tolerance when it comes to meal. We have different spice tolerance, different pepper tolerance in individuals. Now, spicy meals should not, we are not telling you, oh, don't eat pepper at all, or don't eat spices, don't use spices in your food. No, we are not here to punish you. We are here to help you. Now, when you are taking spice foods or when you are having spice food, reduce the spice level to the barest minimum, like totally reduce it. Now, carbonated drinks, we're talking your soft drinks, your colas, your gaseous drink, you name it, any drink that once you open it, you do shh. Yes, that is what I'm talking about. So let us avoid that. It causes the stomach to expand when you take it. Now, when the stomach expands, there is more room for acid secretion. So there is now excess secretion of acid in the stomach. It's just like you are pouring water into a bucket and now you've expanded the bucket. There's more space. So there will be more secretion there. So that's what we are trying to prevent. Now, large portion sizes. This is very related because when we say large portion sizes, what am I talking about? Normally, the standard level when it comes to, let me use the common food, let me say rice. When it comes to rice or soups, the proper or the standard serving sizes for rice and soup is a soup spoon. Maybe I'd have got reference for you, but we know soup spoon, the one we used to cook in the house here. The soup spoon, that is the normal, the standard portion size. So 1 or 2 of that soup spoon, when it comes to rice or soup or porridge, that is the standard size. Anything above that is now a large portion size. And what happens when we have large portions, when we take large portion sizes of milk? It makes the stomach to secrete excess acid so that it can digest that food that you've given to it. And when there is secretion of excess acid, it worsens the ulcer symptoms. Now, late night meals. Late night meal, again, is something related. We say standardly, oh, don't eat once it's past 7. Why do we say don't eat when it's past 7? Because normally, once it's past 7, many people, 80% of humans or citizens are coming to the end of their day. So when you eat after that, there is a chance that your stomach has not been able to properly digest the meal before you go to bed, which is what we are avoiding. But there's a clause. If you are someone who works a late night shift, maybe your own day starts by 8 or by 7, I can't tell you not to eat by 7. So if you maintain a high activity level, what I mean by high activity level, if you are very busy, after 7, you should eat. If you are working a night shift, you should eat. Then when it comes to breastfeeding mothers, you always have to wake up at night. So what do I do as a breastfeeding mother? Doesn't mean I should not eat. Even when I wake up to breastfeed and I'm hungry, eat light. Take snacks, eat light. That is what helps. Now, what are those foods? I've talked about the harmful foods that help. Now, what are those foods that our stomach love when we are managing ulcer? What are those things that we should eat when we are managing ulcer? Now we're talking low-fat, minimal processed carbohydrates. What do I mean by that? You have your oatmeal, you have your pap, you have your sweet potatoes, your Irish potatoes, your pasta, which is your spaghetti, your macaronis, and anyone around that. Now, why are they better? Because they do not stay in the stomach for long. Now, they are very filling, but they do not stay in the stomach for long. But they do not make your stomach to consistently keep on secreting acid and secreting acid and secreting acid. So they're the best. And now, I mentioned potatoes and I mentioned potatoes and other things. Remember, I had initially said you should avoid high-fat diets. Now, you say potatoes, okay, how am I supposed to eat my potatoes? Me, I want to fry potato. No, there are other ways. You can bake your potato, you can grill it, you can fry it. That is a healthier option for you because that way you're not adding in any processed fats, but it's still healthy. Now, non-acidic foods. I talked about acidic food impairing ulcer management. What are the non-acidic foods we have? You have your mangoes, you have your watermelons, your pawpaws. You have those options. Those are healthier fruit options that should be eaten in the case of management for ulcer. Now you have your lean protein sources. What are lean proteins? I don't mean meat as slim. When I talk about lean proteins, you have eggs, you have your chicken breast without the skin, the outer skin. So you have your chicken breast, you have your turkey, you have eggs, you have eggs, you have your chicken breast, you have turkey, you have lentils, you have fish, panla, crayfish, titus, kote. They are all lean proteins and they are very healthy options. Now your steamed vegetables. Now imagine you have a pot, you put in your ugu, your onion, your tomato, your crayfish, and then you steam on low heat, no added water, no added oil. You steam in its own moisture because vegetables tend to produce moisture, they tend to produce water, so they steam in their own moisture. Now, probiotics containing yogurts, like you can see on the screen, there is a beautiful bowl of yogurts. Yeah, so probiotics containing yogurt help reduce the effect of ulcer, which I will explain to you way better very soon. So stay with me. Now, when we talk about meal pattern recommendations, we're talking about small, frequent meals. What do I mean by small, frequent meals? Break down your meals. Don't eat large portions. You can have 3 square meals, is not for everybody. Nobody said as an ulcer patient, you must eat 3 square meals. You can have 4 meals a day. You can have 5 meals a day. I know you're wondering how many hours are in a day that I'm eating 4 and 5 meals. Who have that time? Now, let me give you a visual example. So I'm a worker and I'm managing my ulcer. I have work by 9. I wake up by 7. Now, logically, I should have my first meal of the day between, let's say, 7, 8. So what is my first meal of the day? Low fat. Let's go low fat, low processed protein. So I take oats. I take a bowl of oats, like 1 tablespoon of oats, and then a side of eggs, 2 eggs. Now, some people have different tolerance when it comes to certain foods. So you can dice your eggs into small, small pieces. You don't have to share it into like 20, but 5 is good. So you can cut it into small, small pieces and have water by your side. Let's not forget hydration, very important. So I have oats in the morning with a low-fat milk and 2 eggs. It's fiber. It stays in the body longer. It makes me feel satisfied for a longer time. So now I'm going to work. I dice fruit. I take my fruit as my hand on luggage. Yes, I slice my fruits, my watermelon, my pawpaw, beautiful slices, and I put them in a fancy pack and I take to work. So when I get to work by 9, between the time of 10, 11, I have my fruits. I've eaten twice in the beginning of the day. Now, let's say lunch. What do I have for lunch? I have 1 serving of white rice with a side of steamed vegetables in the morning. A side of steamed vegetables and water, hydration, very important. So now I've had 4 meals in the day, and this is just 2 o'clock, right? So let's say by 3, 4, I have another beautiful bowl of yogurt with nuts. When I talk about nuts, it can be something as simple as granules. You can do granules, you can do cashew nuts, you can do almond nuts. Now, nuts are healthy protein options. So I have a bowl of yogurt, I put in my nuts. When I'm done, I take water. This is just 4 o'clock, and I've had 4 meals for the day. Now for my dinner, before 7, because I work from 9 to 4, remember, so I don't have an activity level after 7 o'clock. So by 7, before 7, I take a fist size of swallow. Why am I taking a fist size of swallow? Remember, we are trying to keep our meal small. I take a fist size of swallow and any soup of my choice that I like. Now, that is the end of the day, and I've had 5 meals, 3 major meals, and 2 snacks. I am full. I am satisfiable. You get me? Now, why do we say frequent meal? Avoid prolonged fasting. Like my colleague said, we know it's Lent period and it's Ramadan period. And no, not fasting does not make you a bad person. As an ulcer patient, you should not fast. Even if it's 2 hours, or let me just do 12 to 2. No, you should not fast at all. Even during the day, you shouldn't go prolonged hours without eating. You need to maintain a constant meal timing. Now, why am I maintaining a constant meal timing? We all know how busy life gets sometimes. Sometimes you can forget you haven't eaten, and then before you remember, your body is already fighting you. All your symptoms are already at the roof level. So when you maintain the constant meal time, I eat today, I eat breakfast by 8. Tomorrow I eat breakfast by 8. Next tomorrow I eat breakfast by 8. We humans, we are creatures of habits. In the next 3 days, before it's 8 o'clock, my body is already pinching me. It's almost 8. Why? It's wine. Just like when you have a small child, and whenever the child comes from school, you give her chocolate. The next day she comes, give her chocolate. She comes again, you give chocolate. Automatically, whenever that child comes back from school, she's expecting chocolate. Whether you are home or not, somebody must be there to give chocolate. That's just how the body is. So once you eat 8 a.m. today, you eat 8 a.m. tomorrow, 8 a.m. next tomorrow, automatically, your body is now accustomed to the fact that, okay, by 8, we are having breakfast. So before 8, the body is already reminding you, let's go and eat, let's go and eat. So then your symptoms don't get worsened because there is no opportunity for it to get bad before you eat. Your body is now reminding you to go and eat. That brings us to the essential nutrients for ulcer healing. We are not just eating for eating's sake. We are eating to help heal the ulcer and avoid reoccurrences. Now, we are talking protein. Protein is a very effective macronutrient. It's a very effective macronutrient for muscle healing and for ulcer healing particularly. Now, what makes up protein? Proteins are made up of amino acids. That is what makes up protein. Now, there's something we call RDA, which is your recommended daily allowances for nutrients. We Nigerians, or people in general, it is very difficult for us to meet our RDA a day or our recommended nutrient allowance a day. Now, that is why we have supplementations. That is why we have over-the-counter. If you come to Kenix pharmacy, we have, dealing on protein, we have so many amino acid containing multivitamins that the professionals there are happy to hand out to you, depending on the condition you give them. Now talking about ulcer, which will help to boost the effectiveness of your healing. Now you're coming to vitamin A. There are so many foods that contain vitamin A, but again, how much can you eat to get your RDA for the day? It is not unachievable. It is, but we as human beings with busy schedules, you're running here, running there, you might not be able to incorporate all these macro and micronutrients into your meal. That is where the supplements come in. Vitamin A is perfect for healing also. Vitamin A, zinc help with muscle healing, same as protein. Now, when it comes to the pharmacy, there are so many varieties of supplements and vitamins that can be given to you to help this your healing, so that it won't be like you are treating and treating and treating and treating and treating and nothing is happening. Now down to probiotics. Why is probiotics important in ulcer healing? Probiotics inhibit the production of H. pylori. They fight for the attachment to the stomach. So probiotics is very important. And again, there are varieties of probiotics. We have so many probiotic supplements that would help you. And in Kenix Pharmacy, our priority is the total and complete health of our patient. We're not just there to hand drugs to you. We want to make sure that you are fine to the end. From nutrition to vitamins to medications, we want to make sure that you are getting the best possible treatment. Now, remember, nutrition does not replace medical treatment. Now, I'm not telling you, oh, because I'm eating rice, okay, the nutritionist said I should eat baked potatoes. That means I don't need to take the drugs again. I never said that. Take your drugs and have your adequate nutrition. They work hand in hand. Nutrition only plays a supportive role. Appropriate dietary choices reduce the symptoms and the severity and support healing. Again, it doesn't replace your medications. Eating adequately is the best thing you can do for your body. It helps with the healing. It helps to reduce your symptoms. It helps to, nobody wants to have irritations or discomfort throughout the day. So that is what nutrition does. It helps with long-term prevention and reoccurrence of this same issue that you are trying to manage. So many people have been managing ulcers for years, but they've been doing it wrong. And that is why Kenix Care Conversation was brought to you here today to help you, help yourself, so that we can all build a healthy society. Remember, medication, nutrition, and lifestyle equals effective ulcer management. No one is replacing anyone. They work hand in hand. They are siblings that work together for the better goal. And that is what we are doing. We are working together for the betterment of the self. Thank you. And for those people who are just joining, I'm nutritionist Adeswa, and I'm here, or I just gave you the harmful and helpful food to eat in ulcer treatment. Thank you very much.
Thank you. Thank you, Fam Uche. Thank you, nutritionist Adesua. Thank you, our wonderful audience who have joined from far and wide to learn one or two things about ulcer management. I want to believe that it's been an exciting, time, and we've learned quite a lot. From which it was so much on ulcer recognition, recognizing the symptoms, knowing what to tell your doctor or your pharmacist. This is what I'm feeling. Is it ulcer? Is it not ulcer? Is it just stomach ache? Is it because I took a lot of iron supplements? That's why my stool is black or tarry. Yes. And then he also looked at how to properly diagnose ulcer. So it's no longer just go for one test and come back and say H. pylori is positive. There are specific tests that he shared that you must carry out to ensure that you actually have ulcer. He also talked about aggressive factors, protective factors. So now you know what you should, stay away from and what you should improve on. And then our nutritionist went deep into telling us what we should eat and what we should avoid when it comes to management, treatment, and prevention of ulcer. She spoke a lot on nutrients that also help us in healing the ulcer and time of eating. I liked when she talked about, ensuring that we are maintaining a regular eating schedule, right? So we eat 8 a.m. today, 8 a.m. tomorrow, and on the third day, our body is already on autopilot to ensure that we are eating at the right time. Yes, so I'm sure we have quite a number of questions on the chat box, and we're going to be looking at those questions now. Please feel free to ask as much questions as possible. We have all our pharmacists, we have our pharmacologists in the house, we have our nutritionists as well, here to respond to all your questions. So you're in a good space this time. You're in a very good space now to learn all you need to learn and unlearn about ulcer, general peptic ulcer. Yes. So the first question we have here is, let's look at our chat box. Please add your questions to the chat box. If you've not placed your question there, if you have any question, add your question to the chat box. And if you also want to speak out, ask your question directly, please feel free to ask your questions directly. You can unmute and ask your questions and they will be answered. So the first question we have here is, how is this bacteria transmitted from parent to offspring? Okay, someone wants to ask this question directly. So let's take that one first, and then we can respond. Mr. Kindly unmute and ask your question. So you can see
Hello.
us.
Hello, good afternoon. Good afternoon. Am I being heard?
Sorry?
Can you hear me? Can you hear me?
Oh, you can't hear.
I'm speaking. Can you hear me? Can you hear me?
Please hold on. Is he asking a question now? Good afternoon. Why can't we hear him? Okay. All right, let me.
Hello, good afternoon.
Okay, go ahead, please.
Can you hear me now?
Yes, we can. Sorry for the.
Yeah, that's fine. That was a very wonderful presentation. I'd like to say I really accord Kenix Pharmacy for, this is my second time out joining this this meeting.
Oh, that's nice.
So I'd like to ask a few questions because I was prepared for this particular class.
Okay.
I wanted to ask the use of these omeprazoles, esomeprazole. Do you think a long use of them wasn't ulcer because they find a way to mask the symptoms of ulcer? I've heard the cases where they said long use of these protein pump inhibitors, they worsen the ulcer because people tend to, not because you use it for a very long time, you can't really know how much ulcer has progressed because it is masking the symptom. That is one. Then the second one is, in most cases, curing of H. pylori, that is eradication of H. pylori, after eradicating it, can it reoccur? That is, can H. pylori reoccur despite successful treatment? Then the last question I had is, I went for Dr. Aproko's one of his events recently, and I heard that fasting actually helps ulcer. So please, I'd like you people to shed more light on these three questions. Thank you very much.
All right. Thank you very much, Mr. Money. We also want to thank you especially for, being a repeat audience for Kenix Care Conversations. So your first question is on prolonged use of proton pump inhibitor. You're wondering if you've used it for a very long time, if that will mask the symptoms and worsen the patient's ulcer. That's correct, right?
Yeah.
All right.
So what you said about prolonged use of proton pump inhibitor is correct only if H. pylori is present. Now, let me explain this to you. proton pump inhibitors alone, when H. pylori is present, can actually worsen ulcer in the long run. Why? Proton pump inhibitors lowers the acidity of the stomach. Now, when this acidity of the stomach is reduced, it even gives more room for H. pylori to survive and multiply. You understand? So, if it were to be just an NSAID-induced ulcer alone, no H. pylori, prolonged use of proton pump inhibitors such as omeprazole won't cause much, won't do anything to only improve the condition. But once H. pylori is present and you are using proton pump inhibitors alone without the eradicating antibiotics, it's going to make the symptoms worse because the H. pylori is going to multiply. Because let me just let you understand that some of the things that makes it difficult for replication of H. pylori include your stomach acid. Stomach acid is meant to kill a lot of bacteria that come in, including H. pylori. Just like H. pylori is a bit stubborn, but still yet it kills some of its population. You understand? So using PIs alone, just like as I said in this slide, when H. pylori is present, it's very bad. It will worsen the whole situation. That is why I recommend you don't get ulcer treatment from your friends, your neighbors. You have to go for the test, know what you are treating, and then follow the right procedure.
Okay. Thank you, Famuchi. Famuchi will take the second question.
Second question, can H. pylori reoccur?
After treatment.
After treatment. Yes. 100% yes, it can reoccur. If we recall from the presentation, the presenter made mention of the risk factors or how we can get the H. pylori. He made mention of direct contact from patient to from person to person, from feces, and from other causes. So when if after treatment we expose ourselves to the feces, to the causative agent, those things we expose ourselves to those things that can cause or that can trigger the H. pylori, the bacteria to come. Yes, we'll have it again. So can it occur? Yes, it can occur. We expose ourselves to those agents. Thank you.
Yes, thank you very much, Chimeze. And then our nutritionist will take the one on can fasting help ulcer? Because he said it attended a program and they said fasting can cure ulcer. So the question now is, how can fasting help ulcer if it can?
So firstly, fasting cannot help us in any way because even when you are fasting, there's secretion of acid in your stomach. And during fasting, you are not eating anything. So your stomach is secreting acid or is producing acid, and there is no food to buffer that acid that is being produced. So thereby, it worsens the symptoms of the ulcer. As I many people tell you that, oh, when I've not eaten for long, I feel pain and I feel this. So there is no way fasting can help your ulcer. It doesn't help your ulcer in it.
All right. So, Mr. Money, I hope that answers your question. Thank you very much for that question. So we'll take the first question on the chat box now. Question says, how is the bacteria transmitted from parent to offspring? I remember this was mentioned in Uche's presentation on how children can have ulcer. When people wonder, can children have ulcer? And then he said, oh yes, it can actually be transmitted from parent to offspring. So let's respond to that question.
All right. The bacteria H. pylori can actually be transmitted from parents to offspring. And most times in the home, most especially in Africa, we usually don't practice the principles of personal belongings. So sometimes you see a mother or a father cutting meat with his or her mouth and giving to the toddler. You understand? And also to personal belongings, their spoons. Sometimes the mom may just use her mouth to, scoop the part from the excess, and then she gives to the child. So if the mom has or the dad has a heavy infection of this H. pylori bacteria, it can actually be transmitted, you understand, to the child. And before you know it, the child is already complaining, "Mommy, my tummy is paining me. Mommy, my tummy is paining me. Mommy, my tummy is paining me." And that's just how it will continue until they go for the test. And most times, because they are children, most people don't even think of ulcer when it comes to children, because they will be like, this child doesn't do drink, this child doesn't take NSAID, this child doesn't do things that will likely cause ulcer. I'm feeding him well, so on and so forth. So this is how H. pylori can easily be transmitted
from parent to
yeah. In addition to that, also through kissing. You know, here in Africa, we love kissing our children. So it can also be transmitted from parents to offspring through kissing. Also through the fecal route. When you as a parent, after using your toilet or your restroom, didn't wash your hand, you use the same hand to prepare the child's food or to prepare the child's account or whatever.
Yes.
It can also transmit it through that part also. Thank you.
All right, and this answers the next question, which says at what age can the children get ulcer? So basically, that microorganism can be transmitted at any age, right? And then it starts causing problems for the child before the ulcer in itself now develops. So it can actually happen to any child at any age if we don't practice good personal hygiene and ensuring that we are taking good care of our health as parents to children. So the next question is, does the kit and the after drug heal the wound already caused by the bacteria? So I want to believe you, when you say after drug, you are talking about the proton pump inhibitor, that's the omeprazole, lansoprazole, and rabeprazole. Mr. Abdul Samad Aliyu, you can unmute and ask your question directly if I'm not correct. Is he on the call? Well, the question is, does the kit and the after drug, we're going to refer to the after drug as either the omeprazole or rabeprazole or lansoprazole or esomeprazole now. Is it there? Okay, good.
Yeah. Okay.
So please ask your question directly, Mr.
Confirm you can hear me.
We can hear you.
Okay, thank you. Thank you guys so much for putting it together. Sometimes, there's so many.
Go ahead.
What would you say? So basically, my point is, everything I've tried about all that is that whatever happens in the stomach actually leads to sort of like a wound. So if that's the case, my question now is, say someone follows up with the kit. He said you take the kit for 2 weeks, then you discontinue and follow up with the other drug payments and propofol. So my question is, if one does all of this, the wound itself, is it going to heal itself such that the person won't have any need for the drug after that?
Did you get the question? Okay, you're asking if the kit heals it completely. And okay, kit and then omeprazole afterwards, if it heals the ulcer completely. Is that correct?
Yes, so that you won't have any need for the drug on the permanent basis.
Okay.
Okay. All right, Mr. Abdul Samad. The kit is meant to eradicate H. pylori. Then, after that 2 weeks of eradication, you have to wait for another 4 weeks. While you are waiting, you keep on taking your proton pump inhibitor, which is omeprazole, rabeprazole, any other proton pump inhibitor. Now, while taking this 4 weeks regimen, after the 2 weeks regimen, it's so that you will wait and be sure if this bacteria, H. pylori, has been eradicated. So after the test, let's say the H. pylori was actually eradicated, they did stool antigen test, and it was eradicated. That doesn't mean that the injury itself is healed. This injury is in the presence of a concentrated acid that is hydrochloric acid. And you know any injury that is in the presence of an acid that is corrosive will take time to heal. So the continuous use of the proton pump inhibitor is necessary, and also making sure, just like my senior pharmacists have said, making sure that you don't get reinfected with the H. pylori again. So the continuous use of the proton pump inhibitor, even after a few months after the eradication, is still necessary, very necessary. And also then, based on what our nutritionists have said, you have to also follow it up with the other modifications of your diet. Okay, thank you.
Okay, I hope that answers your question, Mr. Samad. All right, the next question is, do you have another question? Okay. Did you mention the nutrients? Like nutrients that helps in healing to ensure that okay, just all right, the next question is, I was given lansoprazole 30 milligrams daily without any antibiotics. I've been on it now for 5 days. What's the question? Okay, maybe this person wants to know if that's fine. Okay, so like we said in the presentation, if there is presence of H. pylori, basically using only proton pump inhibitor like lansoprazole that you've been given daily without any antibiotics, you are just reducing the acid content of the stomach. You are not treating or eradicating the bacteria, the H. pylori. So if there is H. pylori infestation, you have to be on 2 antibiotics like our presenter mentioned for 2 weeks before you're now going to be placed on lansoprazole alone for the next couple of weeks. All right. So we have another question here. Can vasoprene cause ulcer?
Yes, it can cause ulcer because it's an NSAID. So remember from the what our second presenter said, that ulcer can also be generated through NSAIDs, the non-steroidal inflammatory drugs. So which vasoprene is also part of it. So yes, it can cause ulcer.
All right. The next question is, can stress cause ulcer? Yeah, go ahead. Yes, stress can cause.
Yes, stress can cause ulcer. It can even worsen it. Yes, it can worsen ulcer.
Worsen it. It might not be the main cause of ulcer, but once there is already ulcer there, if you are undergoing stress, it can worsen the symptoms of ulcer and even elongate your healing time. Yeah. All right. So do we have more questions? Does someone want to unmute and ask directly? Let me know if someone wants. Okay, so we have another question here. Is it possible to not have ulcer but react badly to peppery foods? All right.
All right. It's actually possible when you don't have ulcer, because just like we say, ulcer is a sore in the stomach or the small intestine, but then you react badly to peppery food. Yes, pepper contains a compound called capsaicin, and this capsaicin gives you almost the same burning sensation as fire, as if there is fire burning. So if you have, let's say, gastritis or irritating bowel syndrome, pepper too can also aggravate it, and you have such serious feelings, such as if you have ulcer, but it's not necessarily ulcer. Thank you.
So the nutritionist have something to add to that? Are we good? All right. So the next question is, if you have done the kits for 4 weeks already and your stool analysis still shows H. pylori infection, what do I do? All right. Okay, so basically, if you have done the kits, whether you're doing esophageal kits or pyroxycombi or omeshal kits, so the peptic kits and the rest of them, and at the end of the day, you're still having positive H. pylori infection in your stool analysis, then you might want to also consider sensitivity to some of these antibiotics, right? So some patients who have, misused. I remember our last Kenix care conversations was on antibiotics. Yes, antibiotics 101, where we talked about use, misuse, and abuse. So we saw that some of the consequences of misusing of antibiotics could be resistance. You're not able to respond. The organism is not able to respond to some of these antibiotics anymore. So we want to do a sensitivity test to check if you're able to respond to the antibiotics that are contained in those kits. Also, we also have to look at how you used the kit, because adherence and compliance is very important in ensuring that there's complete eradication of any infection at all, not just H. pylori. And you've used it for the length of time you're supposed to use it. We were taught that you're supposed to use it for a period of 2 weeks. Period of 2 weeks, you used it for 4 weeks in this question. So this also falls in the category of misuse of antibiotics, because advice is to use it for 2 weeks. If the patient is in the habit of using antibiotics for longer than they've been prescribed, then there might be chances of having some form of resistance. Okay. So the next question is, okay, someone is raising their hand, so let's take that person, please. Go ahead.
Who is that? Who is raising their hand? This person speaking. Oh, okay. All right. So while we wait for
the person to come and ask their question directly, we'll take more questions from the chat box. Next question is from Miri Maluko, and this person is asking, when H. pylori shows negative, but there is still high acid causing incessant belching and periodic indigestion, what do you do? So this patient's Helicobacter pylori shows not there, negative, but then the patient keeps belching and having indigestion from time to time. So from my end, okay, so basically there are a couple of medications that can be recommended and a couple of lifestyle modifications you can do as well. Some of the medications that can help with this kind of patient will include antacids, will also include medications like domperidone, PPIs as well. Yes, this patient will benefit from those PPIs you mentioned, esomeprazole and the likes of them. Then also in lifestyle, you might want to adjust, for instance, how you sleep. So instead of sleeping flat, which can, cause regurgitation of some meals, you might want to place your pillow in elevated position so that digestion is better. Then also don't eat late at night. That's also something our nutritionist mentioned. Eating beyond 7 p.m., especially if you don't have an active life after 7. So ensure you eat early enough, not late in the night. Place your pillows in an inclined angle rather, and then take antacids, domperidone, and the proton pump inhibitors. Do you want to add to that a little bit? All right. Next question. Someone raise their hand. Okay, so let's take question from. Go ahead.
Hello, can you hear me?
We can hear you.
Okay, good afternoon, Kenix. Thank you so much for this program. So my question is, I heard from the pharmacist that I will have to do the test for 2 weeks, then do a repeat test.
Say that again. We can't hear you.
I have to do the kit for 2 weeks, the ULCER kit for 2 weeks.
Yes.
Then do a repeat test. So if it
Not
shows
immediately.
positive, I have to
When
do
did
the
you do
kit
the repeat
again.
test? Was it immediately after taking the kit, or did you take some weeks off before taking doing the test, redoing the test now?
I took it after a week interval.
Okay.
Then after the thing came positive, so I did the kit again for another 2 weeks. That's why I wrote 4 weeks in the chat box.
Okay.
Then I did another repeat test.
Okay.
So what do you do in that instance when the thing is showing positive? So you have done the kit 4 weeks already.
Okay, so she did the kit for 2 weeks, did the test after 1 week. Is that what I heard?
Yes, ma.
Okay. Oh, yeah, continue.
All right. So the first thing is you after doing the kits, after taking the kits for 2 weeks, then you take your proton pump inhibitor for the next 4 weeks before the test. And mind you, the test has to be done with this same stool as a sample, not blood. Because one thing about the blood is that the blood is an enclosed system, and even after the antibiotics in that kit is done eradicating the bacteria, some of the dead materials of that bacteria will still keep circulating in the blood, which the test can also detect. So you wouldn't be able to say if it was eradicated or not with the blood, but most times it will give you something called a false positive result. But you use this tool because the physics is always moving out. So for the period of 4 weeks, your stomach has changed several times. So this tool now can be able to say, okay, if the H. pylori is actually present or not. So 4 weeks interval, but you must be on your PPI. Even after the 4 weeks, once you notice it's negative, you have to continue your PPI and support with also your antacids too. So 4 weeks is the period of time you have to wait before checking, and you have to use the specimens too to run the test. Or rather, there are also other simpler tests like the urea breath test, where you are given a solution to drink, then but from the gases produced, they will know if H. pylori is in the stomach or not. It's a very simple test that can be run in a lab. Thank you.
Okay, I hope that answers the question. Okay, all right. So the next question is, I heard you say H. pylori is a bacterial infection. Immune boosters help boost the immune system to fight against bacterial infection. Do immune boosters help to prevent H. pylori? Okay. So basically, yes, H. pylori is a bacterial infection. Yes, immune boosters help to boost the immune system to fight against bacterial infection. However, the immune boosters will not prevent you, immune boosters alone will not prevent you from having H. pylori infection. Sorry? Can you hear us clearly? All right. So, like I said, H. pylori is a bacterial infection. Yes, immune boosters help to protect your immune system from infections. However, alone, they cannot do that. They cannot protect you or prevent you from having H. pylori infection. Because if you look at the presentation on how you can contract this bacteria, you will notice that immune boosters will support your system to, to the point that, oh, H. pylori is not bringing you down as much. However, if you expose yourself to these danger practices of not practicing good personal hygiene and not protecting yourself from the aggressive factors, you are going to come down with ulcer and you're going to come down with a H. pylori infection. So I hope that answers that question. All right, so the next question says, what do you mean by H. pylori? I know we've mentioned it a lot during this presentation, and it's almost like second nature. H. pylori is Helicobacter pylori. That is the name of the bacteria that is implicated in ulcer. All right, the next question is from Mr. Prosper. He says, is ulcer kit antibiotic? So ulcer, so calling it ulcer kit is actually, trying to put all of them under one bracket. There are so many kits that are used to treat ulcer, and they usually contain 2 antibiotics and 1 proton pump inhibitor, which is 1 omeprazole or rabeprazole or lansoprazole. So to use a kit to treat ulcer, so I want you to think of it as a kit used to treat ulcer. Don't think of it as ulcer kit. A kit used to treat ulcer. So the kit contains 2 antibiotics. It can be amoxicillin and clarithromycin. It can be amoxicillin and tinidazole. It can be clarithromycin and so on. Always 2 antibiotics and then 1 proton pump inhibitor. So it is not just an antibiotic. It's a kit containing 2 antibiotics and 1 proton pump inhibitor to ensure that you're eradicating the bacteria. So the antibiotics is to attack the bacteria, the Helicobacter pylori, and then the proton pump inhibitor is to reduce the hyper oversecretion of acid in the stomach. Secondly, is H. pylori. Is it H. pylori that caused peptic ulcer? So this was in your presentation.
Yeah. Okay. From the presentation, we said that there are 2 major factors, which include the NSAIDs, long-term use of NSAIDs. That's NSAIDs are non-steroidal anti-inflammatory drugs. So these NSAIDs include diclofenac, ibuprofen, piroxicam, indomethacin. They are very good. They are good and they are used for pain relief. But when you take them for too long or you abuse them, you understand, it's going to, erode the walls of the stomach. Secondly, H. pylori. H. pylori is a bacteria that can be transmitted from contaminated food, water, and even person to person. You understand? So thirdly, it can be a combination of both. You understand? So these are the 2 major things that can cause peptic ulcer.
Okay. I hope that answers your question, Mr. Prosper. All right. Ngozi Chukwukama is asking, okay, sorry I came in late. My question is, what is the cause of this bacteria that is causing ulcer, and can it be prevented? Thank you very much for the program. You're welcome, Ngozi Chukwukama. So this is same question as the other one, almost same question as the other one. So our question is, what is the cause of this bacteria, and can it be prevented?
All right. As we know, bacteria are living organisms. Just as we humans, we are moving around on a daily basis trying to survive. So are bacteria. There are different kinds of bacteria. There are those that cause pneumonia. They are trying to survive in the lungs. There are those that cause skin infection, trying to survive in wounds and so on and so forth. Likewise, H. pylori. H. pylori is trying to survive on the walls of the stomach. So the only way you can prevent this bacteria infection is by practicing good personal hygiene. You understand? Good personal hygiene, and also eradicating it when detected. Once you notice that there is somebody in the home that is carrying this bacteria or that have been tested positive, you have to also endeavor that you help this person eradicate this bacteria so that it doesn't spread to others in the house. Thank you.
Yes. Okay. So the next question is, at what level does the ulcer lead to back pain? Or what leads the ulcer to back pain?
Well, just like we heard from the presentation, when there's an ulcer, there is a sore on the stomach lining. And so long as the sore is there, and when the sore continues to expand and so on, the pain at the back there will lead to pain at the back.
Okay. All right. So the other part of the question is, apart from Athertech that you mentioned during the presentation, what other drugs are safe for ulcer patients? Okay. So apart from Athertech, there are plethora of medications to relieve pain in ulcer patients, and they are all available at Kenix Pharmacy. First one is Protec. Protec contains diclofenac sodium and misoprostol to help protect the lining of the stomach while the diclofenac is able to exert its pain relieving action. The Protec is one very good example. And then we have other options like celecoxib. You can also do paracetamol to relieve your pain and ofenadrine as well. But in all, when you want to take these medications, you always advise to take them with food, just in case they cause you any level of irritation. So these are some of the examples, other examples of drugs that an ulcer patient can use to relieve their pain. So Protec, celecoxib, paracetamol or Panadol, ofenadrine. These are examples. All right. You're welcome. So the next question is, please, how long do I have to use the kit to completely eradicate ulcer? Okay, continue.
At least from the presentation, the presenter said 2 weeks, which is enough. At least, let me just say 2 to 3 weeks of the kit, then followed by 3 to 4 or 5 weeks of the PPIs.
Yes, and then followed by advices from our nutritionist, ensuring that you're eating properly. And then you're also taking nutrients to help you in proper healing. Like she mentioned during her presentation, we might not be able to get the required daily allowance from what we eat directly. So we might also need some supplements to augment to ensure that we're getting the necessary micronutrients to help first of all strengthen our immune system, increase our protein, vitamins, and then of course ensure that we are healing. Yes, so again, these multivitamins, the particular ones that contain these particular nutrients and micronutrients she mentioned, are readily available at any of the Kenix Pharmacy branches in Community Road, on Agor Palace Way, and of course in Bucknell. And if you're not able to reach physically, you can always order via WhatsApp on the numbers that are currently being shared on the screen, and they'll be delivered safely to you wherever you are with the correct advice to guide you on appropriate use. So yes, you're welcome, Ijoma. All right, do we have any other question in the chat box? Do you have anyone who wants to unmute and ask question? We have a new question for our nutritionist. And the question says, can beans worsen ulcer? So beans, regular rice and beans, can beans worsen ulcer? This is a very interesting question because I had this conversation yesterday, I believe, and a couple of things were mentioned. But our nutrition, good enough to have a nutritionist here, the professional in food business, to respond to your question on beans as a position when it comes to ulcer management.
In as much as beans is an affordable main protein, beans, however, stimulate the production of gases in the stomach. And in the case where we are dealing with ulcer or ulcer management, we try to prevent excess production of gas in the stomach. So basically, beans should be avoided in ulcer, in as much as tolerance is different in so many people, still, this is not an advice, it's not a food we would advise to be eaten by people who are trying to manage their ulcers.
Thank you very much, Adesua. So the next question is, please, in aged persons that, in an aged person that has ulcer already, how can she manage this bacteria for it not to rise again? Yes, this question, let me even start from, because this question kind of, and what food is preferable for such patients? Yes, there's even something we need to mention about aged persons that have ulcer, because we actually see a lot of older patients that come down with ulcer, specifically because some of them are managing arthritis, right? And in managing arthritis, you will need some of these NSAIDs we've talked about. So NSAIDs are actually useful. In as much as they can worsen ulcer, they are useful, very useful in relieving pains. So for a patient, an aged person who might be having arthritis, the patient might be taking diclofenac, for instance, or even prednisolone. And that's why it's important that when you come to the pharmacy to buy medications or to make complaints, you say the medications you are taking. For patients who are suffering from arthritis and have to take diclofenac, you don't necessarily have to take the plain diclofenac. I've had patients that are aged and are using piroxicam to manage the arthritis. These are some of the drugs that can worsen your ulcer. In as much as to relieve your pain, it can worsen your ulcer, right? And that's where the place of medications like Protect comes to play. Instead of using plain piroxicam or plain diclofenac, you use medications like Protect to relieve your pain and prevent ulcer from developing. Now, how to manage that this bacteria will not rise again, affection shall not rise again. So, is to use your medications appropriately. Use the kit containing 2 antibiotics and 1 proton pump inhibitor appropriately, as we have advised. 1 tablet of each in the morning, 1 tablet of each at night for 2 to 3 weeks, and then followed by a proton pump inhibitor for 4 weeks. You treat appropriately, and then you practice good personal hygiene, right? That's basically how to prevent, to ensure that it doesn't happen again. And like our nutritionist advised, some of these foods, okay, I remember she said she didn't join early enough. We mentioned some of the helpful foods and some of the harmful foods. So nutritionist just mentioned a couple of the helpful foods now for Ngozi Chukwukamma. So we'll be able to, you can advise your aged relative or friend appropriately.
Okay, so when it comes to health foods that help manage ulcer symptoms, we are talking about lean protein, like I mentioned earlier, and examples of lean proteins, we have eggs, we have chicken, we have fish, any type of fish can be used. Then non-acidic fruits, your pawpaws, your watermelons, grapes, if you can get it, they're suitable to work perfectly. But also remember that there's no one size fits all when it comes to diet plan for ulcer. So just follow this. The lean proteins, the non-acidic fruits, caffeine containing beverages, and avoiding sodas for the meantime. And she should be fine. She should help her manage her ulcer appropriately.
Okay, so there's a question here. Can someone do test and bring it for you guys to know the type of medication he or she is to start with first? Definitely. At Kenix Pharmacy, you have over 6 qualified pharmacists. We have a pharmacologist. We have pharmacologists, not just one pharmacologist. And then we have nutritionists as well. So Kenix Pharmacy is the perfect avenue for you to properly manage your ulcer, get the right medication in the right way with the proper advice that you follow. So Mr. Prosper, you're welcome to any of the branches and you will be well attended to. All right. So the final question we have here is, in an aged patient or on hypertension medication, can she use the ulcer kit alongside it? Yes. So we have to, for this patient, hypertension can be managed with a number of medications, and that's where medication assessment comes in. We practice complete holistic care at Kenix Pharmacy. So we'd want to look at the medications you are taking and then see how they will sit well with your ulcer medication. And then we also want to manage your pill load, because if you're already on ulcer medication, you're already taking three tablets, or rather three capsules, let's just say 3 tablets or 3 capsules in the morning and at night. So if you're taking other antihypertensives, you want to know which ones you're taking to see how we can space them and ensure that you don't have a lot of pill load per time to take. And if there's any interaction, we would also let you know. But we have to know the particular medications you're on to be able to advise appropriately. So we would receive more questions on any of our WhatsApp lines. Okay, let's just quickly take this last one. I heard the last presenter saying when you're done with all the proper medication, 2 weeks and 4 weeks, the test, he will recommend you to do these 2 tests, not blood tests. Can anyone throw more light on it? Yes, he mentioned we do stool analysis as opposed to blood tests, because you have a more accurate result from these 2 analysis. That's basically what we said.
They do it in the lab.
It's done in the lab. So always submit, go for stool antigen test instead of blood analysis. That one, the stool analysis gives us a more accurate, reliable result to use. So, all right. So I think we will bring the program to a close now. I want to thank Kenix Pharmacy Limited, first of all, for giving us this opportunity to have our Kenix Care Conversations, the first one for the year. And want to thank all our pharmacists in the house, our pharmacologists, our pharmacy assistants, our nutritionists, for contributing immensely to the success of this particular edition of Kenix Care Conversations. We'll have more editions in time to come, and we hope that you, our wonderful, wonderful, very active audience, will also join us to learn 1 or 2 things to improve our health outcomes and the quality of our health. My name is Ugonna Ayolube, and from all of us at Kenix Pharmacy, I want to say thank you and have a very wonderful day.
Thank you. Thank you.
Bye, bye, bye.